I think the big question in people's minds is who can they trust for their information about mental health, right? On the one hand, we have big pharma, and there have been some incredible breakthroughs. I'm a psychiatrist, I prescribe medications, and I find some people really it saves their lives. And you don't hear that in the media. This week I've heard a number of antidepressants called a miracle drug, a miracle cure, and I don't take any money from big pharma. I've just used these medications for over a decade now. For some people, they're lifesavers. Then there's the supplement industry. And the supplement industry is really largely unregulated. They make a number of claims that really aren't supported by the evidence, and it gets people into a notion, this happens a lot, where instead of taking a medicine that's been closely studied and brought to market and closely monitored, they'll be taking 5, 10, 15 different supplements. It's hard to know as a physician whether that's safe or not, and whether that's really warranted. There's a lot of delay in terms of people getting appropriate treatment. And then of course we have talk therapies, right, which tend to take longer time and cost more money. So this is where I think food comes into the picture. Right? One is we all can agree we trust food, right? For the most part, if it's a whole food, it grows on a farm. I mean, there are concerns about big pharma, but I've never heard a concern about little farmers, right? So that's where I try to direct people. And I also like it as a psychiatrist that it's one of my interventions that is absolutely delicious, that people like, that people can do for themselves. We're in an epidemic of mental illness, and we're also in an epidemic of misinformation about mental illness. I mean, the amount of stigma that we see still, and the embarrassment that my patients have for a victory over some of the most debilitating and disabling illnesses and deadly illnesses in the world, it's concerning as a doctor. I see people just profoundly ashamed by how they're feeling and the illness that they have. So I think we have a long way to go. I think we're getting there. I think more and more, I've been a psychiatrist now for, 16 years. There's a change in the conversation. People talk about having bipolar illness. People talk about being treated for depression. Men talk about being treated for depression really for the first time in history, in a way that gives me some hope. If we can have a more open conversation, we can make a bigger dent. I mean, now it's more than 40,000 suicides a year in America. We have 600,000 veterans with severe traumatic brain injuries. We have a lot of work to be done, and on the front lines of mental health, I think I just try to remind myself to sit with my patients, to do no harm, and to give them a menu of options. I think that's one of the things that's gotten missed in this whole discussion about mental health. People talk about how many people are kind of over-medicated in America, and I always like to point out the 10% of Americans that take antidepressants in the morning, they do that voluntarily because it's something that's helped them. And I think that when we talk about an over-medicated society, sometimes we miss the point. I would say that we're a mis-medicated society. I've seen a lot of people in my practice who are just on the wrong meds for the wrong reasons. And I've met even more people who've never ever had a trial of even something natural like St. John's wort that has incredible evidence that it's a very, very good antidepressant. And I think that's the part, the folks who aren't getting any help, that's the most concerning part to me, because that's when people end up in real trouble.